Hello physios, get back to my channel. Today we learn on topic on lung infections. In this, there are three infections we're gonna to learn. Those are your bronchial asthma, bronchiectasis, and lung abscess. In firstly, we will learn with bronchial asthma. Bronchial asthma is a disease characterized by an increased responsiveness of the trachea and bronchi to various stimuli, manifested by widespread narrowing of the airways, causing paroxysmal dyspnea, wheezing, or cough. And its pathophysiology and its airways obstruction in asthma is caused by your edema and inflammation of mucosa, bronchospasm, and it leads into the airway obstruction, excess of mucus production. So these are your three factors to contribute to the airway obstruction, which will interfere in the lungs of mucociliary. And in this there is also a flow chart. In this, some example like any triggering factors, it might be immunologic or non-immune system, and it leads to bronchospasm, so it leads to inflammation. In inflammation, it may cause edema, excess mucus production, and thus you can get the airway obstruction. And ventilation will be perfusion, it will be an abnormality, and hypoxemia, that is low oxygen content, and hyperventilation, it leads into decrease in partial carbon dioxide and increase in pH, and hypoventilation, that is increase in partial carbon dioxide and decrease in pH content. This is next comes to your classification, extrinsic and intrinsic. Your extrinsic applies to those who produce excessive amount of IgE antibodies in response to the allergens. So those are called atopic. And intrinsic asthma refers to those cases in whom excessive IgE production cannot be demonstrated. That is non-atopic. That cannot be demonstrated. That is why intrinsic asthma. And the causes are your viruses. It can be in childhood viral infections, cigarette smoking, allergens like chocolates allergy, dust, pollen, smoke, milk, fronds, etc. Clinical features, we have wheeze, dyspnea, cold, chest tightness, breathlessness. And investigations, we go into the radiological examination, and your lungs will be on hyperinflated. We can also go for the pulmonary function test. Complications, atelectasis, pneumonia, middle ear infections, sinusitis. Management, when the bronchioles are dilated, you can use salbutamol and terbutaline, steroids, mechanical breathing through the ventilators. So next comes into the bronchiectasis. It is also a disease characterized by permanent dilation of bronchi caused by accumulation of exudative material, resulting in chronic cough with some foul smelling, that is in sputum production. And the etiology or bacterial and viral pneumonia. It can be abnormal ciliary production and there is function, and viral infections, measles, TB, pertussis, example like cystic fibrosis, hypogammaglobulinemia, neoplasms, congenital tachycardia. So these are your examples. When it comes into pathology, except cystic fibrosis, in bronchiectasis, due to some of the causes like generally, so it leads into the some of the segmental in lobe. So those lobes will be involved in the lower lobes. In lower lobes there will be some segmental distribution. And morphologically two types, cylindrical and saccular. Your cylindrical goes into some dilation and it is reversible. Firstly, the normal columnar epithelial cells undergo some changes and becomes into cuboidal. It means columnar into cuboidal. And due to some impaired secretion, there will be some mucus glands increased, leading to some increased amount of your mucus secretion. So which in turn leads to persistent infections of the lobes of lungs. And in chronic cases, there will be bronchial artery occlusion. Next comes your clinical features like foul smelling, sputum early morning, wheezing, clubbing, cyanosis, fever, anorexia, paroxysmal cough, respiratory infections, and investigations X-ray, CT scan, bronchography, and sputum culture. Treatment, you can use antibiotics, you can go for PT chest physiotherapy, you should take good nutrition intake and chest percussions and posture drainage. Surgical, like segmental or lobar resection, or you can removal of your pneumonectomy. These are your treatment. Then lung abscess, it is a subacute suppurative disease of the resulting in a formation of cavity by containing pus material. It means abscess is nothing but you are any pus containing in the lung. And etiology, usually it will be in chronic and persistent aspiration, and so some of the predisposing conditions like it is a severe disorder, it may unconscious state, or it may be any poor oral hygiene, dental procedures, intubation, or staphylococcus aureus, some other like Haemophilus influenza, streptococcus pneumonia. And these are your etiology. And clinical features: high grade fever, cough, chest pain, dyspnea, sputum production, hemoptysis, foul smelling, dullness of percussion, and decrease in the breath sounds. Investigations, you can go total WBC count, that will be elevated with neutrophilic predominant, and chest radiography, it may show one or two more thick walls cavities, there is a cavity of the lung, and CT scan to localize and differentiate any of the lesions, bronchoscopy, and gram staining, sputum culture. So these are the notes of your lung infections for the bronchial asthma, bronchiectasis, and lung abscess. Thanks for watching SPN. For further notes, subscribe to my channel and show some love support. Thanks for watching.